I am pleased to introduce myself. I'm Dr. Ezekiel Mupere. I'm the chairperson for Child and Family Foundation Uganda. So CFU is a non-government organization registered with the National NGO Board since February 2002. Has also a 9-member on the board. And the composition of the members on the board include members who are in the veterinary, professionals who are from agriculture, and we also have members from the missionary or mainly faith organizations in church who are reverends. Then we also have the secretariat that implements the activities of Child and Family Foundation Uganda. CFU was established or registered with an aim of trying to complement the government efforts in particularly addressing issues of disease, poverty, illiteracy, and disability, which have remained a vicious cycle from generation to generation. And also, most of the members on the board decided to come together to register and grow this organization because of the backgrounds from which most of us came from, that were poor. We grew up struggling in poverty and struggling to make the best future with the parents. And up to today, still when we go back to our rural places where we came from, we normally find that the children or the women are still struggling with the same background that we struggled through over the last 40 years or 30 years. And so this impacted on us a lot, and we said that the only way to reach out as a group was to come together and come up with an organization where we can reach and try to change the background of our people and also beyond, to complement the efforts of the government so that we can be part of a contribution in addressing the disease, illiteracy, or poverty among the poor, particularly in the rural areas and in the urban poor settings, where we know that accessing services, reaching services is a challenge. That up to today, our mothers still deliver under unskilled hands, a large percentage of them, although the numbers keep increasing, but still a substantial percentage still have challenges in accessing services. So that's why we developed, or we registered, we came together to develop, register and grow CFU. Our vision in Child and Family Foundation Uganda is to have a world that is without disease, poverty, illiteracy as our main focus. And our mission is to have excellence in providing innovative interventions, service delivery, research, and advocacy in reaching the poor, the vulnerable groups, and people with disability in the urban poor and in rural populations or communities. The objectives of CFU are mainly to improve access, use, and availability of healthcare, nutrition, and relevant education among the urban poor and rural, to improve access, use, and availability of livelihoods and food security to still in the same populations that are vulnerable, and also social and economic empowerment to the vulnerable populations in these settings. Over there, since Child and Family Foundation Uganda was established, we have 2 community medical centers or facilities. We have one here in Kampala, and we have another in the Kamali district. They offer both outpatient and inpatient services, and largely primary health care, and the target is providing maternal child health services such as antenatal, immunization, in addition to addressing the common illnesses. We do outreaches to the community. Currently, in Kampala, our main headquarters are based in Kawempe Tula, and it's where also our medical center is established. And we are linked to the community through community extension workers whom we train as an organization in reaching out to most of the families that are affected. And right now, in addition to the community medical centers, we all have also a running program supported by the Infectious Disease Institute at Mupere in conducting active case finding for particularly child with TB, children with severe malnutrition, and missed opportunities of HIV diagnosis in children in the Kawempe division. What we do is to identify and index either adult or child at any of the public institutions. Here, particularly we link with or work with Komamboga Health Center 4, we work with Mulago, Mwana Mujimu, and TB clinics. And when we identify an adult who has TB, we follow this patient as our index to the community to identify any extra cases of adult TB, and also screen the children in these households. And also what we also do is identify a child with malnutrition, particularly severe malnutrition, and we follow this child and the caretaker of their household to identify any extra cases of acute malnutrition or children with severe malnutrition, and we screen the whole family. And then also what we do is we take such a spot or a residence as a hotspot for either malnutrition or TB or missed opportunities of HIV, and we screen additional 30 households within that area of residence to identify extra cases and to identify those that are at risk and to identify those that have had missed opportunities of diagnosis, and we link such families or children or individuals to care. We bring some of these to our medical facility here in Itula, Kawempe, where we offer the outpatient services and inpatient services. However, those who are unable to completely provide the comprehensive service, we link this to centers of excellence. Let me start Mulago. And those that who prefer other services elsewhere, they are linked to. And also thereafter, we continuously through our extension workers continue to follow the families who have such problems of children with severe malnutrition, or have adults with TB or children together in such households, or where families they have HIV and also children, so that they continue to receive the comprehensive services. And through our community extension workers, we continue to follow such a family or such a child or such an adult in order to ensure completion of treatment. And also, in addition, within this catchment area, we provide health messages to the communities or the families around who are gathered through our extension workers, and they provide continued health education or awareness about particularly three main disease conditions as their common problem, particularly in children, and also they are quite interlinked together. So that's about briefly the health services which we do offer as a nutshell. Although we do more than that which I've described. Let me say we do medical camps in reaching out to mass populations in these communities. And I've mentioned only Kawempe division and Kamoli as where we have fixed health facilities, but we also operate in other several districts, particularly in the eastern region. We've gone to Kayunga, we've been to Namutumba, we've been to Uganda, and in a number of these districts we do medical camps, we do public awareness messages in increasing understanding as far as disease issues are concerned. Beyond the health services, as I've already articulated in among the key areas of CFU includes health, nutrition, education, livelihoods. So in an effort to improving the livelihoods of populations in the urban poor or in the rural, but also linking the health facility with the community. We have established community saving and cooperative societies within our organization. We have a circle group here in Itula, and we have also another in Kamoli where we have the medical facility. Because the objectives of our circle is to prevent the daily out of pocket for the members, particularly for services of health, education, such that and also other income generating activities. Because we find that many times whenever people fall sick, they have to pick from their pocket, and sometimes illness come when people are not prepared. So what we've done as an innovative way to use this platform of circles, as people come for saving and credit services, we integrate health scheme savings, such that they can save for their families, for their loved ones, such that in times when there is illness, then they have a leverage to be able to access services, both at our medical facilities, but also they can receive referral services to any nearby health facility beyond which we may not be able to provide the services at our medical facility. Then also we use that platform to provide health education to the members of the when they come to attend during monthly regular meetings. And in this way we've reached out to hundreds of families, and families come, we normally encourage them during the monthly meetings to bring their whole family for screening. So we also offer preventive screening for any illnesses that they may be having that needs attention. And in this current era of non-communicable diseases, we're able to identify patients or clients who may be hypertensive or diabetic. We're able to identify children who have had missed opportunities of immunization and several other conditions. So in that way, we are able to reach out or to use to maximize such opportunities as far as health is concerned, even as people access financial access together. Then in addition, of course, mothers or caretakers, particularly the women, struggle with their children in terms of school, so they're able to get to save for the children in terms of school fees, or they're able to get credit in terms of to ensure that their children are able to continue without breakage because of tuition or school fees. So in addition to circles and what have you, we have also introduced the health and agronomy, where we are integrating health services together with the nutrition to ensure food security, to ensure a balanced diet particularly in the households of where children may be malnourished, or where families poverty is a big problem, whether urban or rural. So we have health and agronomy programs or activities whereby women are taught how to have a backyard garden, so that they're able to have a year-round with fruits and vegetables. Even if somebody does not have a piece of land, but they can put vegetables in a sack. We taught them how to prepare these, and this has been a very compelling and innovative approach in supporting particularly the women caretakers in our community division. Among the key innovative approaches that we are offering or conducting. Then also our target is also in terms of relevant education, we'll be targeting childhood development. So as mothers come either for circle or as caretakers come for this health and agronomy, or other health activities, that aim will be introducing early child development in terms of stimulating children. Because several studies have shown that only providing food is not enough without child stimulation. If you have children who are becoming better adults with development. So these activities have also been integrated in our programs in order to achieve our key objectives and key focus areas. Those are among the few that I can mention at the moment in terms of demonstrating what we've so far done or what we are doing. And in order to achieve the objectives or the vision or mission of Child and Family Foundation, we cannot do it alone. We have to do it in a partnership, as you all might be in knowledge or aware that addressing disease or addressing poverty or literacy requires partnership. And also we know that poverty or disease, most of these are a vicious cycle, and it requires multi-sectoral approach. So Child and Family Foundation, we do not work alone. But in all these districts that I've mentioned, partially let me say here in Kawempe Division, we work directly with the Division Health Office, we work with the Education Office. We've signed also Memorandum of Understanding, partially in the rural districts with the Kamuli, with the Uganda, we are extending to Kayunga, and some of also these other districts where we work. So we work with the local government, and also we identify partners in each of these districts or in our services, either community-based, in an effort to have a comprehensive package to the families or to the individuals who may be affected or involved with the disease or with poverty in a comprehensive way. So, in order for us to sustain our services, in order for us to comprehensively offer services, we continue to seek out to partners to join us or to open up so that we can leverage within any both government, both private partners, donors, because we know that our resources may be definitely limited, and we also would love to offer or reach out to a number of families or a number of affected or involved children or women or the disabled, but we may not have enough resources to bridge the gap as we complement the services of the government. So we continue to seek out partners or donors to support some of our activities or some of our programs to be able to impact on lives or to be able to save lives. Because what we've learned or what we know that particularly in our country or in our environment, there are gaps, not because policies are not in place, not because there are no interventions that have been proven to work, but because of lack of a collective effort in reaching out or to improve coverage in reaching the poor, reaching the vulnerable, or reaching the affected. So we seek support from any donor. It can be an individual person, it can be a business person, it can be a philanthropist, so that we can be strengthened in order to continue sustaining the impact of some of the programs. Once again, I would like to thank the listeners to this message, and that I've made Ezekiel Mupere. I'm a medical doctor, I'm a pediatrician, and I'm a researcher. I'm the chair of Child and Family Foundation Uganda, and being a chair for this organization has given me a great experience, has given me a lot of impact in knowing what we can do to save the lives of the poor or the vulnerable, and what kind of benefit and appreciation these families or individuals who will be affected once they receive or they are reached out with such interventions. And I also do teach at Mupere University and based at Child at the Department of Pediatric and Child Health, Mupere. But this opportunity as being a chair gives me an opportunity to contribute to community as one of the mandates to offer to community. So thank you very much for listening.